So in this second section regarding gastritis, we'll be studying about the different types of classification of gastritis. So in this section, we'll be studying about infectious gastritis, the different types of viral, fungal, bacterial infections, and then the distinctive types of gastritis, an allergic gastritis, and the hyperplastic hypersecretory gastritis. So firstly, if we talk about the infectious gastritis, there are a variety of infections that causes gastritis. Firstly, being the viral consisting of cytomegalovirus. So cytomegalovirus is usually the virus that is the most common cause of gastritis within an individual. So this type of gastritis is usually occurring in patients who are more immunocompromised or patients who have cancer or have been through any radiation or chemotherapy. This sort of cytomegalovirus occurs in patients with any type of these therapies and who are more prone to being more immunocompromised. And grossly, if we see this cytomegalovirus, we can see that the patient might present with edematous sort of gastric mucosa and ulcers which are more hemorrhagic. Other than that, if you see microscopically, we can see the inclusion bodies which are more specific for cytomegalovirus, which is also has an appearance of an owl's eye. Other than that, other viral infections including herpes virus. Herpes virus is usually occurring in patients who are more younger, and it occurs in patients at an early age. This sort of herpes virus is also presenting with varicella zoster virus, which is also a part of herpes simplex viruses. This virus is also occurring as a form of a dormant phase. This virus, when it enters the body of the host, it has a more dormant phase, and then this virus can also reactivate in patients who have been through chemotherapy or in any radiation therapy, or they have any sort of cancer or lymphoma. So this sort of herpes simplex virus or varicella zoster virus, if you see more grossly, the patient might present with hemorrhagic ulcers, and more microscopically, the patient might present with the inclusion bodies, and the presentation of these herpes virus is the erosion within the epithelial cells. Other viruses, including measles, is also present. If you talk about bacterial infection, mycobacterial infection tops amongst all the bacterial infection. Mycobacterial infection causes tuberculosis gastritis, which is also called as TB gastritis within individuals. If you see more grossly, the patient might present with granulomatous sort of appearance within the epithelium, and microscopically, the patient might present with stains of acid-fast bacilli. The other type of bacterial, including actinomycosis and syphilis and other bacteria. If you talk more specifically about syphilis, syphilis could be presenting in patients with secondary syphilis or tertiary syphilis. These type of patients, they also have gross appearance such as hemorrhagic, and these patients are more prone into having a more upper gastrointestinal bleeding presentation because these ulcers are more hemorrhagic. If we talk about fungal infection regarding gastritis, it includes candidiasis. Candidiasis is usually occurring in patients who are more immunocompromised and patients who have been through treatments with steroids. The gross appearance of candidiasis regarding gastritis is that the patient might present with more edematous and superficial erosions. And if you see more microscopically, we can see the yeast cells and the pseudohyphae within the epithelial cells of the stomach. Other than that, the fungal infections including histoplasmosis, mucormycosis, aspergillosis, and cryptococcosis. Lastly, the more severe form of infectious gastritis is the parasitic gastritis, including the cryptosporidiasis and the giardiasis, strongyloidosis, and anisakioidosis. This sort of parasitic infection in regard is is more common as compared to other sort of parasitic infections. This infection is usually occurring after the ingestion of raw marine fish, which is usually ingested in Japan. And these patients usually present with upper gastrointestinal bleeding, and the gross appearance is of these pseudohyphae that are present within the gastric epithelium. Other than that, ascariasis and necatoriasis is also a very famous form of parasitic infection within the gastritis. So if we talk about more distinctive gastritis, this includes collagenous gastritis, which causes a form of gastritis. It is usually characterized with collagenous duodenitis, collagenous colitis, lymphocytic colitis, celiac disease, and other sort of autoimmune disorders, such as diabetes mellitus and thyroid disorders. So these patients usually present with anemia, epigastric pain, and diarrhea. And if you see more grossly, the picture regarding the gastric epithelium is that the mucosal surface has a more of a mosaic-like pattern, and microscopically it has a very patchy infiltrates and chronic gastritis sort of a picture and focal deposition of collagen. As you can see in this picture, this has the epithelial surface of the stomach has a more collagenous epithelium and the deposition of collagen on the more superficial epithelial side. So the second type of distinctive gastritis is the lymphocytic gastritis. This has a more dense lymphocytic infiltration within the surface and the gastric epithelium. It is usually associated with Helicobacter pylori infection and MALP lymphoma, and it is also associated with celiac disease, HIV infection, Crohn's disease, and different types of medications. This sort of gastritis is more infiltrated with T type of lymphocytes as compared to B lymphocytes, and it has a flattening of the epithelium and it has loss of apical mucin secretions. As you can see in this histological picture regarding lymphocytic gastritis, it has the flattening of the epithelium as compared to the normal epithelium of the stomach that has gastric pits within the surface. So within these pits there's a very dense colonization and infiltration of the lymphocytic cells. Lastly, the third type of distinctive eosinophilic gastritis is the eosinophilic type. The patients usually present with abdominal pain, nausea, vomiting, and weight loss. Eosinophilic infiltration and pit abscesses occur within the epithelium. So that was more of a lymphocytic. There was the infiltration of lymphocytes, but in this type of gastritis, there's a dense infiltration of eosinophil cells. There's usually necrosis with the numerous type of neutrophils and epithelial regeneration. And it is usually treated with steroids, and it is treated surgically, the gross appearance of the epithelium. As you can see in this picture, the infiltration of neutrophils within the surfaces. So now we come to a more different type of gastritis, which is called as gastritis cystica profunda. So this usually occurs as a complication of partial gastrectomy or gastrojejunectomy. Gastrojejunectomy being that in this sort of surgery, the stomach and the jejunum part is completely resected from the GI tract. It is usually associated with Meniere's disease and some sort of gastric cancer. It is inverted hyperplastic gastric polyp, and it may present as a variant. So if we talk about more gross picture of the gastritis cystica profunda, it has multiple nodules, as you can see in this picture regarding cystica profunda. There are different multiple nodules present, and it has a more exophytic type of a mass, as you can see in this picture B. This is uh, it presents the edematous gastric epithelium, and it also consists of a mass-like picture, which is called as the exophytic mass. And it also consists of different types of cysts, which is very thick and multiple. And if we see more microscopically, the patient might present with foveolar hyperplasia, cystic glands. Cystic glands can also cause a misdiagnosis and misdiagnose it as dysplasia or gastric cancer. And lastly, it usually extends into the submucosa, sparing the mucosal surface. So there's a different type of gastritis known as the gastric graft versus host disease. This usually occurs in patients who have undergone transplant. It usually occurs after bone marrow transplantation, which is more of an allogenic type of transplant. The patient might present with nausea, vomiting, or upper abdominal pain. This sort of gastric graft versus host disease comes in an acute and a chronic form. Acute being that the patient had a transplant between 21 to 100 days, the gastritis might present, and a chronic form would be that the gastritis might present after a quantity of a limit of 100 days. So we usually perform a rectosigmoid biopsy in this type of gastritis, and there is also a presence of necrosis, which usually consists of intraepithelial vacuole filled caroheroic debris. As you can see in this microscopic picture, histological picture, we can see this intraepithelial vacuole that occurs within this type of gastritis. And lastly, the allergic type of gastritis, it usually occurs in children and in infants who are usually allergic to cow's milk protein. So these type of infants and these young patients, they present with gastritis and present with pain and excessive crying. So there's a different type of hyperplastic gastropathy, which is very common these days. It consists of giant gastric folds associated with hyperplasia of the epithelium. As you can see, there are very prominent folds within the gastric epithelium, and it consists of hyperplasia. It consists of two syndromes, one being the Meniere's disease and the other being the Zollinger-Ellison syndrome. So if we talk more specifically about Meniere's disease, we can see that it is associated with protein-losing gastropathy. These patients with Meniere's disease present with weight loss, epigastric pain, vomiting, anorexia, dyspepsia, and hematemesis. Hematemesis being the patient might present with blood within the vomitus. It is usually self-limited and may completely resolve in patients if this type of Meniere's disease occurs in patients less than 10 years. And it is also a risk factor of gastric cancer. As you can see in this endoscopic picture, we can see the multiple nodules within the epithelium of the gastric. It usually has, if you see more grossly, it usually has irregular hypertrophic folds. It has a very swollen, spongy appearance, subdivided by creases, and the diagnosis is usually taken by a full thickness gastric mucosal biopsy. As you can see in this microscopic picture, there are different folds within the epithelium, and the treatment of the Meniere's disease is that it consist of partial or total gastric resection, that the patient might have to go through gastrectomy and the complete or the partial removal of the stomach. That's all from this section regarding the different classification of gastritis. Keep watching sqadia.com.